from what can damage or stop them from multiplying, or as we say, replicating. Guys, put together. I don't want you to try to memorize things like that. Try to understand from here to here. All right?
All right. I think I had an issue knowing this one, so I wrote it down. So, can somebody tell me what enuresis means? Enuresis?
E-R-E.
E-N-U-R-E-S-I-S. Enuresis.
Are you kidding me? Enuresis. E-N-U-R-E-S-I-S. And nobody in here can just say what enuresis is?
All right. The answer is.
No, stop. Why is it that we're having problems with these words? Why? He said enuresis. It's exactly what it is. E-N-U-R-E-S-I-S. Enuresis.
It has to do with urination. Alright, so it means the inability to control the flow of urine and involuntary urination.
No, at night is nocturia.
Nocturia is at night.
Enuresis. Guys, why you mix it up like this?
Enuresis.
Nocturia is at night. Enuresis, you're wet in the bed. Polyuria, you're peeing too much. Anuria, you ain't peeing at all. Oliguria, you're peeing a little bit.
This is met. This is
All right, guys, continue.
Terminology. All right. What agents are best for catheter care? What agents are best for catheter care? A client has catheter, you're gonna go care for it, clean it up, whatever. What agents are best for catheter care? I'm guessing soap and water.
No. Alcohol. It's not alcohol. The dog thing. What do they call it again?
Betadine.
Betadine?
To clean it?
Yes.
But just use soap and
Betadine
water. You only use soap and water.
I think so.
You don't use
Alright.
that because that's like a medication.
So I'm thinking, what is the best agent for catheter care? I'm thinking soap and water.
That's what I think.
Oh, to clean it? It's
Soap and water? Normal saline?
You have to use like antibacterial soap.
Antibacterial soap.
It's a perennial care.
It's not perennial care.
Read the question for me, sir.
Alright. Well, it is.
Soap and water.
Yeah, it is perennial care. Soap and water. I think it's soap and water. I haven't checked the answer yet. I think it's soap and water. So the
Oh, no, not better. Betadine is before. Sorry.
Alright, the question is, what agents are best for catheter care? Alright? You have urinary catheter. You're gonna care for it. You might want to take it and you're not changing it.
No,
you're gonna clean it up.
You're gonna clean it up.
I was talking about. I was doing colostomy. All right. Here's the answer. Soap and water. Soap and water. All right. Next question. What drugs is used to treat bladder spasm?
Just going back, I heard person say betadine. Who comes up with betadine?
No, my mistake. I thought he said to care before you insert it.
All right, just ask for clarification next time.
Pardon me.
All right. What drugs is soap and water?
No.
What drugs is used to treat bladder spasm?
I know it because my son.
What drugs is used to treat bladder spasm? What do you think, Mercedes?
My son using this medication.
I'm thinking, what drugs is used to treat bladder spasm? I'm guessing antispasmodics. I could be wrong. I'm not. The answer is not here.
You did it.
It's just memory. I think it's memory. Yeah. Flashcards. But I could be wrong. All right. What drugs are used to treat bladder spasm? What do you guys think? I think antispasmodics. But don't listen to me. I could be wrong. I just heard spasm, and I said spasmodics, antispasmodic. What do you think, What do you think, Tisha?
Oxytrol.
Antibiotic.
To treat bladder spasms.
Oh,
Bladder spasms. What do you think?
What you said, that's what I.
You think so? What do you think? Sony, what do you think?
Oh, I'm not dead.
Natalie, you're not sure?
Farrell, do you know?
Pharrell? Alright, let's answer.
Who said my name?
The answer is B and O suppositories, balloon and opiates. Suppositories. You
What?
see, I was wrong. You see?
balloon or what?
Belladonna and opiates. Somebody look that up.
Opions.
Suppositories. What drugs is used to treat bladder spasms? It's called B and O suppositories.
B spell it.
B and O suppositories.
B and O.
Suppositories.
Hello.
Belladonna and opiates. Suppository. Belladonna and opiates. Never heard of that one before.
Spell the word for me.
Belladonna.
Here. Oh, you're right. Look. Bellon. Bellon. Whatever. I bring it out.
Alright. Belladonna and opiate suppositories to treat bladder spasms. Alright. You guys might want to take a note on that one. Next question.
Spell it.
I passed it. Belladonna and opiates Belladonna and opiate suppositories. Alright, next question. Will the post-prostatectomy patients be impotent? Will the post-prostatectomy patient be impotent?
What?
The question is, will the post-prostatectomy patients be impotent?
Will the post-prostatectomy patient
Be impotent.
That question.
Nadesh, what do you think? Sasha, what do you think? What do you think?
No, Shanta not here.
Sandra, I'm sorry. Sandra, what do you think? Will the post-prostatectomy patient be impotent? Will they be impotent after prostatectomy? What do you think? You don't know? What do you think? You don't think so? Gabrielle, what do you think? After prostatectomy, would a patient be impotent after the procedure?
Yes.
You think yes? What do you think?
We.
You said no?
No.
You said no. You said yes? Alright. BK? What do you think? After a man goes for a prostatectomy procedure, surgery, would they be impotent after it?
Yes.
Alright, okay. What do you think?
Anybody else?
You think yes?
See balls?
Yes.
Alright. Natalie, you say yes too?
Anybody else see balls?
Alright. Alright. Here's the answer. After a man goes for a prostatectomy surgery, will they be impotent afterwards? Let me tell you something. If men know they're gonna be impotent after they go for prostatectomy surgery, you think they'll be going? Exactly. Think about it. All right, here's the answer. If it was a transurethral resection of the prostate, there'll be no impotence. If it's a perineal prostatectomy, yes, there will be impotence. Prostatectomy, yes, there will be impotence. All right, so we want to look up TURP, and you want to look up perineal prostatectomy.
Alright, but before you go to the transurethral resection, prostatectomy, and all that sort of stuff, which is a term. Basically, what you need to know to answer that question is what is the function of the prostate gland?
This one is big.
What is the function of the prostate gland? If you're doing a partial and doing a resection of the thing, it is not taking it out. But if you're having a total prostatectomy, you're removing the gland. What is the function of the prostate gland? Guys, what is the function of the prostate gland?
To produce the the semen and stuff. Prostate? Yeah.
What's the function of the prostate gland?
The gland to produce.
Why do you have a prostate gland? It's just like we hear women have breast cancer, men have prostate cancers. What is the function of the prostate gland? Why do men have prostate glands?
To push the urine out or the semen?
Semen.
Semen? Semen or fluids?
Provide fluid.
What, guys, look in your laptops and see what is the function of the prostate gland. What's so difficult, guys? Please.
The prostate gland primary function is to produce the fluid that nourishes the transport sperm. Seminal
That's what I said.
The sperms is not going to survive without.
The fluids from the prostate.
Every time a man has an ejaculation, they don't have those nutrients and nourishment, it's not going to live.
So, just like you said earlier, like the women have acid.
It nourishes the
and
sperm.
All of that.
So it keeps the sperm alive.
Guys, go look for the urinary system. One of the things you definitely want to do is also do the male urinary system. I hear questions. I heard a couple of questions. One dealt with a child that was 5 months old and whether she should do retraction of the prepuce. And then I hear this other question that's been thrown out. Just read. But you must know what's the normal functioning, because if you don't understand it, because they wonder how they're going to ask that question. A man who had prostatectomy stated XYZ. Do you think this patient require patient education based on what he just said? And then they're going to put, and you have to understand that. That's how the questions will come. Like I said before, they're not going to ask you what's prostatectomy. They think that you based on your normal anatomy and physiology, they know that you know what's the male reproductive system, what's the female. So when you go now to the pathophysiology, how can you make that comparison? And what they're looking for is now, if you give these patients medications, how's it going to affect that patient? How the disease process, and based on the disease process and your knowledge of basic anatomy and physiology, how's it going to affect the patient and what would be your response as a nurse? All right, yesterday we went through quite a few things, and persons were kind of linking all the psychiatric conditions as is linked to other disease processes that might be happening in the body. Okay, I do hope that you guys understand that, because that is like the core of your entire nursing process. Okay? It is like the very core of your nursing process. The central nervous system that's affected by just not the CNS and the PNS, but the mental, emotional, and psychological effect. And that's what time yesterday was focused on. The use of the psychotropic medications, the adverse and effects, what doctors need to do and what the nurses need to do, right? That was the focus. And you would read up and you maintain in that. So based now on what I just heard with reference to people, some people not even understanding what systolic and systole, we're going to quickly go review some cardiovascular, and hopefully persons will be on board. Now, for those persons who were not here yesterday and before, what we're doing for these last couple of days at your classroom is basically going over things that for the first couple of weeks ago, I asked you guys to write out things that you know well and things that you don't know well. And based on those, we're trying to go over these things. During these sessions, I want you to be able to ask questions and try to be able to identify where your weaknesses lie or what you need to focus more on. Okay? This is not where I'm just giving you something to follow, but based on what you have been talking about, like just now I heard some things that you need some clarification so you can move on along that. Mr. Keir was, I guess, doing a review from one of those
Mark Klimek. Mark Klimek.
Whichever one is review courses. And based on those answers that I'm getting, I'm kind of, concerned with the rationale. Because remember, the question is always why things happen, why you do so. The question is why all the time. All right? Why? All right. Very quick, and you got to stay with me because we got to move fast. Before we get directly into the cardiovascular system, we have to do the very first thing that you do in nursing is functional, all right, when we talk about the cardiovascular system, we usually talk about it in 3 different parts. We went through that already. We went through with the cardiac, we went through with the vascular, and we went through the components.
Okay.
And under each one of those categories, we want to talk about the pathophysiology. Other than the heart, we know that the heart have different problems. During the time we did maternity, we did also the fetal heart. And coming out of that, when the baby is born, we talked about congenital problems. We also spoke about those congenital problems and what can cause the congenital problems. That's what we did in the last week and yesterday. All right? So now moving on. Cardiac problems, adult. Cardiac problems, newborns. Neonatology, within the first 4 weeks of a baby's life. People will know that the heart is a muscular pump, approximately the size of your fist. The heart pumps approximately, or has, the heart has 3 layers. Pericardium, myocardium, and endocardium. It has 4 chambers. It has 4 valves. On every one of those areas you can have a disease process affecting it. So let's start first with the adult heart. When the adult heart pumps blood, because that's its most That's the main reason why you have the heart. It's to pump blood around the body. It's a muscular pump. And the muscular layer of your heart is called your myocardium. And you as a nurse, one of the things you want to do right now, because you know the heart pumps blood around the body, you want to know that the heart too receives blood. How does the heart receive blood?
Coronary artery.
It comes from the coronary artery. So if it comes from the coronary artery, you want to look at CADs,
Coronary artery.
which
disease.
causes coronary artery disease. What causes coronary artery diseases? You talk about plaques. You talk about what else?
The narrowing
You talk about narrowing.
of the
And at that time, and this is just about a week or two ago, we talk about arterial and atherosclerosis. We talk about the hardening. It's your arteriosclerosis. But when you start having the deposition of the fat, we start talking about your atherosclerosis. And we said that this CAD influenced by IHD. And what is IHD? Ischemic heart disease, meaning that say that same coronary artery is having those narrowing. And when it's narrow, it means that less blood is going to those parts of the heart that's supposed to supply. So when that happens, you get a what? An angina. Angina pectoralis, right? Or angina pectoris. And with the angina, you have two types, stable and unstable. This one here, which is stable, when you get the pain, it's usually after you're doing
exercise.
Exercise.
or exertion. So to relieve it is easy.
Resting.
Rest.
Rest. Write them down.
Sometimes, based on what's happening to the patient might be put on glycerol, right? Trinitrate. But when the patient is unstable now,
During rest.
even when this patient is
At rest.
resting, they can still have their pain. Now, if this blockage continues, if the narrowing, which is this is the vessel, out there, narrowing start happen, but if the narrowing blocks now, it leads to a
Infarction.
myocardial
Infarction.
infarction, which is an MI, also known as a heart attack. And when the person have a heart attack, unless they get treated right away, they will kick the bucket. Because remember, the function of the heart is to pump blood. We said we don't want to mix up MI with when a patient gets a CHF. And what's CHF? Congenital heart disease. What causes a congenital heart disease? Okay. You have several different things can cause congenital heart disease. That can result in increased pressure within the heart. Pulmonary stenosis is a problem. And with that, because the patient not getting the problems, it could lead to the CHF. Now, CHF is when the heart is failing to function properly. Stay with me, please. As a pump. Failure to the heart to function properly or effectively as a pump. Not the heart stop. It is not functioning properly. That's the difference between stopping and myocardial and not functioning effectively. Okay? And this here, we talk about things that can happen, that can cause it. VSD,
Ventricular septal defect.
atrial septal defect. Because we talk about those congenital problems that have holes in the heart, right? And these problems can lead to either you can have a right to left
Left
shunt
shunt failure.
or a left to right shunt. We went through to explain. And what you need to know is that the patients who have a right to left shunt is the one that's a problem. A big problem. You also need to know that when you're doing the adult heart, you also have to look at the conduction of the system. So when we talk about the conduction system, because I want to understand that the heart is beating regularly and the rate is being maintained. Because if the rate is too fast, it's called a tachycardia. And you could get an atrial fibrillation. When the rate is too slow, you get a bradycardia. But you got to know the difference between an adult, an infant, and a fetus. Because the heart rates are different. What's normal for fetal heart will be considered to be very bad for an adult. Now that craziness when we talk about a short way, in fact before I go there, let's continue this here. The heart needs that conduction system so that those muscles
Contract.
not just contract, because muscles contract, right?
Effectively
But we have three types of muscles.
striated.
We have the striated or the
Striated or
striated or
autonomic.
skeletal muscles, also known as your voluntary muscle.
Voluntary muscle.
Then you have your smooth or your involuntary muscle.
muscle.
But the one we're talking about right now is your cardiac muscle, which is a striated muscle, but you don't have control over it.
That's crazy.
So based on that, you have to get this heart, which is being controlled by your CNS. Did we talk about a lot yesterday, right? CNS. Involuntary. Control involuntary. And with this involuntary, you have a problem. And I hear some nonsense. I'm sorry. I heard Mr. Key was talking some stuff and people were saying systole and I was like, what the hell you guys, what's going on? Is this your last month?
No, no te conoce.
It sounds like the farce, like you guys know starting anatomy physiology. My God. Anyway guys, stay with me, let me run through this. I don't have much time more for this. We have the SA node. Sinoauricular node, right? That's a pacemaker. And so the pacemaker send what?
The signal. The electrical signal.
Give me what's the name that they call for this signal. What do they call it? An impulse.
That's an electrical signal, okay.
It sends an impulse.
Pulse, okay.
And where does it send the impulse to?
The SA node.
Oh God, stop that. Where does this impulse goes to?
The right and left ventricle. The right
It goes to the atrium. And what it causes the atrium to do?
contract.
Why?
So blood can be filled. So blood can go into.
So why is it contracting? Why is the atrium contracting? To empty the blood out of the atrium. And what's going to happen to this impulse now? It goes to the AV node. And what the AV node does? Exactly, because it doesn't give the heart time to what?
To rest.
Refill.
To
And you can't have both upper and lower chambers contracting at the same time. So it slows it down. And next it goes to where? and to the points of hits. And there's where you get to, you have your left and right bundles, blockage. Left side bundle block, right side bundle block. When you look at the EKGs, pick up your nonsense. So with the heart, with the patient's heart, you need to know right side, left side bundle block, left to right shunt, right to left shunt, right? What is the manifestations? And you need to read these out. What causes it to go from right to left? What mixes the blood? What makes your bright red blood that goes around your body, make your body become cyanotic? Because of the movement. Because of those holes. You know when I talk about foramen ovale, talk about fetal heart. And 6 months after birth, it's supposed to close. That's not no problem because it's in the atrial area. But when you have a follow-up tetralogy, you have 4 things are happening and not 4 hearts. 4 things. Right? VSD. And a patient with VSD, and they have pulmonary stenosis, you have increased pressure, you push the blood back from the right side over to the left side. Coarctation of the aorta. You guys need to know that. Defect on your valves. Defect on your mitral valves. That's caused by rheumatic fever. So now, as the person is growing, the valves are messed up. And what the valves are supposed to be doing for you? Preventing backflow, right? Fix the heart. And then you have all the other little things. Pericarditis, myocarditis, endocarditis. All those are infections, right? And that is the medical aspect. Then you can have the surgical aspect. What heart disease do you require to have surgery for? Come on, we got to read it. This is your last month. Put it together. What heart disease do you have surgical heart surgery or cardiac surgery required for? What are the, come on, we just talk about medical. Surgical now. What is the surgical you'll be reading about? What surgical procedures to know to do in the heart? Talk to them, please. Talk to them. Go ahead. Tell them. They do bypass. Why they do bypass? Hear the word bypass. So why are you doing that bypass? Stop. I want you to talk. I want to hear all the people here talk. Why are you doing bypass? What blockage are you talking about? What blockage are you talking about?
Arterial?
Enough, right, not enough blood. But I have a blockage where? The coronary artery, right? So they got to do something to replace it. So, or they go wrong it. So when they go wrong it, you have a what? A bypass. What bypass are we talking about?
Coronary artery bypass?
What's the name of the bypass? What bypass are we talking about?
Coronary artery bypass surgery?
Coronary artery
Bypass surgery?
Coronary cabbage, right? Cabbage is what
Cabbage.
What's the difference between cabbage and stents?
Stents is you put a device to open it up.
Like a little brick,
Yeah,
smaller staple to open the.
to open the vessel.
Use stents to open the vessel.
Yeah.
But then they do cabbage, right? Because they can find that the stents can't work in certain patients. So do the cabbage. Call this open heart surgery. I think you guys should do back into your angiomas, your myocardials, look at their review. We'll use the word review. The pharmaceutical, the non-pharmaceutical, then you go into your surgery. Right? And most of all, look at what you as a nurse supposed to do. Right? Because, yes, we talk about cabbage. Patient can have cabbage. Patient can put stents in. But what is your role? Patient come back from cabbage, or what you have to do before the patient goes for the cabbage. What would be your role? And that's where the questions will come to coming. Cabbage is a doctor, not you. What will be the nursing management?
Infection control.
What are the things that you will be looking for? What are the things you'll be assessing as a registered nurse? So you say you got what? You look at the blood pressure, right? Okay, so you look at the blood pressure. This patient got to get rest?
Yes.
Do you think there's going to be bleeding in the chest?
It could happen.
Do you think you have thoracentesis? Guys, when they do surgery, and they do open heart surgery, you bust open the chest. Because they go to the chest, they have to put a tube up in there. And the tube is to, because they've been cutting in there. Remember cutting the heart? They're taking it from the legs and putting it up here. And remember inside of your chest, what's the language inside your chest called? Come on, stay with me guys. I don't want to hear no about myself. Unless I ask a question. Because I'm very concerned today. What is the lining of the chest? What is the lining of the chest and the chest organs? What lines it? What is that membrane called? What is that membrane that lines the chest?
The cardiac.
What lines the... So when we talk about things like pleural effusion, pleuritis, it don't ring a bell?
Pleural cavity.
Here you go. So why are you talking about pleural membrane is a problem?
Pleural cavity.
Pleuritis. Remember the pleuritic pain, the pain when you breathe, as different from the beating of your heart, the chest pain that is to your heart and not to your lungs. Because it is the pleura is involved. We went through this. And now you must be able to differentiate and understand. So when you see it come up in your exams, you will not have a problem. If there's a pleuritic pain, you're not going to be like, pleuritic pain, what the hell are you talking about? You know the type of pain. You know the pain management that is going to be done for it. It's not just chest pain. You guys have to do, remember what doctors do, differential diagnosis? What is the underlying cause? And that's where you come in. I'm not talking to doctors, I'm talking to you as a nurse. What you will do when you assess the patient. Because the patient will be complaining to you. This is now where you've got to be focusing on your entrance exam and how those questions will be asked. We passed through that stage of anatomy and physiology. Gone past that, way past that, long time ago. Or you should be way past that right now. Do your pathophysiology of putting things together. Throwing in your pharmacology, nursing management. Everything was done in incremental steps. The normal, anatomy and physiology. Pathophysiology, disease process. Pharmacology, what medications are you going to use to handle that problem? Nursing management was a non-pharmacological approach. That's a system. And that's what we're going to use. We've got to use a system. The heart by itself have a lot of issues. But if you do it like how we just started, just stated, you did not even have a problem. Remember, it's a pump. What is going to affect it from being a pump? I mentioned savings, right? That can affect it. IHP, that can affect it. Baby born with problems, that's going to affect it. That is, the holes, all the different holes, PDA and all the different stuff. That's going to affect it, right? Absolutely. And when the last couple of weeks we look at the fetal heart, the developing heart versus the adult heart. And then when you have the neonatology is when you're going to find all these different problems, right? They're not going to find those problems later on. You go with it. Vascular. So what are the vascular problems we look for? We're looking at there, arteries, the veins, and the capillaries. The artery opens, nice, bright, blood that's oxygenated to the different parts of the body, right? Arteries, arterioles, and all that nice stuff. And then at the level of the capillaries, we know that all the exchange takes place, right? But when it's exchanging, what happens? It lost what?
Fluids.
Lost fluids. And where's this fluid coming from?
The
Where's this
plasma.
fluid coming from? The plasma. What plasma is there? The liquid part in
The
your
blood,
right?
yeah.
And how much blood is supposed to have in your body? 5 liters.
5 liters. 5
So,
liters of blood.
if you don't have 5 liters, what's the problem you're looking at?
Anemia.
Give me something else.
Hypovolemia.
Hypovolemic. Hypovolemic. Is this going to cause the heart to work harder?
Yes.
Absolutely. Absolutely. It's going to cause the heart to try to make up and work harder. And what do you think is going to happen when the heart starts to work harder?
Gotta get bigger.
You can have cardiomegaly.
Cardiomegaly.
But what else
Cardiomegaly.
can happen when the heart starts working extra hard? High blood pressure.
Hypertension.
And what does high blood pressure do to these arteries? It damages the arteries. And when it damages the arteries, what happens next?
Atherosclerosis.
When it damages the arteries, what happens? Come on guys, what's the problem when it damages the
Angina.
arteries? Don't talk about veins, don't talk about capillaries, just talk about the arteries.
Angina pain. No.
When it damages the arteries, what happens? When the arteries get damaged, what happens? It's tough. Artery get damaged.
Chest pain, shortness of breath.
Chest pains. Well, just do the rationale. Artery get damaged. You know, yesterday we were talking about things that is genetic. Right? Things that is degenerative and progressive. And if you find that the arteries are getting damaged. Did we talk about dementia yesterday?
Yes.
Or what did we say about dementia? We break it down into the different categories how it should be going, right? Psychiatry, right? One into the other, why it happened this way, why it happened that way. Right, remember? We look at the first thing we talk about was what? What's the first thing we look at yesterday?
Alzheimer's.
We kind of look at what's like, all right, she said schizophrenia. We look at schizophrenia, we look at schizoaffective disorder. We look at it different. But the very first thing we start talking about is what? Bipolar. And then we were able to link bipolar to the schizoaffective disorder. Isn't that so? And we said because you don't want to get them mixed up between schizophrenia and schizoaffective disorder, because what bipolar are in, we went through, and that's why I give it to you guys that way. Postpartum, but we come with the bipolar and the schizophrenia. Remember the whole thing I tell you guys, don't mix it up, and we went through it. So now when you go to dementia, you had dementia, they had the Alzheimer's type dementia versus what? And know the difference between what's dementia, what's Alzheimer's type, what's senile dementia? We talk about those behavioral, we talk about those degenerative diseases. The same thing comes to your heart. The same thing goes with your heart. You had for dementia. Vascular dementia. What causes vascular dementia? High blood pressure. Damages your cerebral arteries. And that you did in psychiatry yesterday. Not just TBIs. Not just a stroke. But dementia is cognitive psychiatry. Alzheimer's type dementia. When people die with senile dementia, we went through all that nice stuff yesterday. But you gotta put it together, guys. Gotta put it together. No! Vascular. Vascular. Think of the word vascular. Vascular dementia. Peripheral vascular
disorder.
disease. It's a group of them. We come under peripheral vascular. I don't expect, I expect the guys who were here yesterday to blow through this. I really did. So let me just move on now. Okay, so vascular. And we know, let's go to the veins. What problem to get to the veins? What problem to get to the veins? Thrombosis. When you get an infection in your veins, what do you call it? Phlebitis, right? Because phlebotomy is just withdrawal of blood, right? Phlebitis. Persons get phlebitis. How is a vein different from an artery? Don't tell me what the blood is. Tell me what the structure. How is a vein different from artery? Because this is where you're going to be doing your pathophysiology. Don't tell me that. Tell me what is the difference in structure. Listen to them saying. What is the difference in structure? Here what you guys are going to tell me. You guys are going to tell me arteries got bright red blood because it's deoxygenated. Veins are dark because they're not deoxygenated. Right? You're going to say that arteries carry deoxygenated blood, lots of hemoglobin and what have you? I'm going to hear that.
Arteries.
But I'm asking you what is the structure of the arteries? No. Listen to me again. Listen to me. No, don't shake my shoulder. Listen to what I'm saying. I'm asking you what is the structure? Because the structure will denote the problems.
The veins have valves?
Veins have valves. Does artery have valves?
No.
Why do veins have valves?
To prevent backflow.
So how does blood goes back to the heart? How does this blood move?
Muscular contraction.
Do what? Muscular contraction help to push it along. So these valves gonna stop it from what? Back flowing because they don't have the pressure that's in their what? The arteries. And when problems happen in there, you can get a lot of what? What's happening when you get to your legs? What is called
Valves.
why just get to the other problem in the leg? It's this big veins.
The side of it.
When you have varicosities and what have you, when you have decreased blood flow, you know it's a decreased blood flow, right? You get something called dependent edema. How do you think you're getting dependent edema? You got to know the structure. If it's not going back the way it's supposed to go back, you're going to have to get a picture. That's how we talk about structure. There's a rationale. You want to understand the rationale. You need to say and try to remember as soon as you're talking to people. Because the veins stop it from going back. Because if you go back, you have a problem. And now is when you're going to go further and look at the capillaries, because the capillaries, guess where you lost all those fluids, right? Plasma. And you have their what? Lymphatic system. And what the function of the lymphatic system? To what? It's sending fluid back where?
To the blood. Spleen.
Stay with me, guys. And he's right. But where does this, what's the fluid you call the fluid again?
Lymphatic fluid.
The lymphatic fluid. Or the lymph. Where does this lymph goes? Where does it stop it? Where does it put it back into the blood? Which part of the body does it put it back?
Explain.
Because the part of your body depends upon pressure. The lowest point of pressure to get back into the body. When you talk about pressure, guys, it's very important. Because when we talk about hypertensive crisis, when we talk about systolic, and just so somebody read, systolic is the highest point of pressure exerted on the arteries by the forceful contraction of your ventricles. That's crap. You want to know why? So my question to you guys again. Where in the venous system, lymphatic or lymph is put into the system, put back into the system. Don't sit around and wait for somebody to come up with it. You guys look, every one of you look and research it now. You guys sit around and wait for somebody to look and read it, research it right now. Where and why? And then you understand why you have these demons, why we have these problems.
Where and why?
Come on guys, come on.
What's the question?
What was the question, Tia? Rose, you know the question. What was the question?
You said which part of your blood vessel? Yeah, what part of your blood vessel?
He said these don't connect to the subclavian vein.
Subclavian vein.
Okay, where is it put back? Where is it put back into the bloodstream? Sub what? Subclavian. And what's upon the pressure? At the level of your subclavian. It goes back into your subclavian. Where's the subclavian? Put your fingers in your subclavian area. This is your clavicle. Subclavian. Subclavian. Not subscapular.
I didn't know.
Alright? So, because why? Where's your heart?
Right here.
Right here. So it's put it back there because you have a lowest point of pressure, nothing to push back the blood. There's nothing to push back the blood. The blood is going to just flow into that area. Alright. And one of the things also we know that the lymphatic system does is that it's also part of your immune system. Is that so? Yes.
What about the lymphatic system?
Yeah. So when it takes that fluid from the capillary areas, what happens to it? When the lymphatic system takes that fluid that's being lost at the level of the capillaries, what happens to that fluid?
It extracts some stuff from it. like that.
How? How? You guys are saying the right thing, but how?
The lymph
It
node.
filters it.
The lymph node.
So it goes through the lymph nodes. And the lymph nodes, that's what gets swollen, guys. Remember when you get an infection, it don't just take that fluid and just put it back in. Because it can put diseases back into the blood. It can pick up disease and put in the blood. So the body, the beautiful body God give us, put a check and balance in place. And it put over 600 lymph nodes around the body for that purpose. To filter it before it puts it back into the blood at the level of your subclavian. Because there is where you're going to have the lowest point of pressure. So we don't have any problem with the flow going in there. You guys, let's move on. High blood pressure, you got to think about what high blood pressure does. All over the body, different things, be psychiatrically or physiologically, psychiatric and psychology, sorry. And what it does to the person in other respects. We went through the depth yesterday, and I'm not going to go through that today. Moving on, I'm not going through the thrombocytes and that. You guys know that. That's what beyond that. Let's go to, you know the muscles, right? And the muscles, we just start with the cardiac muscles. And most times people who have problems with the muscles, they come under the neuromuscular system. Again, the CNS is involved, right? Why? Because the CNS is what sends messages after receiving what? Senses from your sensories, right? Because you have 3 parts to it. And a while ago we heard about cranial nerve 7, right? Because the person was having what?
Facial paralysis.
Right. Remember I give you guys as 12 cranial nerves? I said don't ever forget it, because it's going to come back and haunt you sometime. See how the question came? Do your cranial nerves. Understand where these cranial nerves affect. And just like the nutrition is going to come. Nutrition will come. Fetal heart will come. I'm going to tell you straight up. Fetal heart will come. Nutritional questions will come. Infection control problems will come. Okay, now muscles, as we said, muscles move from bones towards each other, right? What does the bones join to the muscles with?
Tendons.
Muscles to bones is ligament.
Tendons. Tendons.
Tendons. Ligaments is bones to bones. So you got torn ligament versus a torn tendon. 2 different stories.
Muscle to bone. Ligament. Bone to bone. Tendons.
We could get muscular pain, right?
Bone to bone.
Most times, when persons exercise a lot, they say they get what?
Bone to bone.
Pain, right?
Ligaments.
You're going to do some stretching exercises.
Muscle to
Next
bone.
day,
Tendons.
you like can hardly walk. Because you put the body through something that it's not accustomed to. Alright? So when you have pain, muscular pain, Or you get joint pain. Any other pain? I could break this muscle pain into heart pain. And when you have a heart pain, you talk with what? Chest pain. What else a pain you could think about? Come on, guys. Stomach pain. Stomach pain, right? You could talk with what? Toothache. You could talk about headaches. The knee pain will come on there. Did I put joint pain? Got joint pain already.
Back pain.
You get back pain.
You get baby pain.
Delivery pain.
Pain all over.
Generalized pain.
Generalized pain. Now we got heart pain right here.
Broken heart pain, love pain.
Love pain.
All right.
Mr. West Pain.
Love pain. Mr. West pain.
And PIA.
Mr. West pain.
And PIA.
Oh no, this is Mr. West pain educational.
Pain in the ass.
And PIA.
You get what else pain here? You can put
Pain
it
in
on
the
pain
ass.
over here. You can get what?
Pain in the ass.
You got PIA.
Yeah, that's what I said. You're getting paid.
Maybe the Mr. West pain is a PIA pain.
That's exactly what I said.
You got, especially women at the end of the month, they get their
Cramp.
periods, right?
Period. Cramp.
It's sharp, abdominal pain.
Menstrual.
And we could go on and on. Eye pain, earaches. We could just keep going on and on. But all of them have one thing in common,
Pain.
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 So when patients are having pain, you go to what? As a nurse, we look at what?
Pain relief.
Pain
Reliever.
management.
Management.
And what's very important about pain management? The what? It's right there.
Huh?
The answer is right there.
What's the
You have to know what is the underlying cause before you can do treatment.
pain?
Alright? You can't say treat all pain as the same. So you go through pain management. And when persons are going through pain management and it is not effective, what do you think, what do you call the pain management? Don't work. And the patient sits up here with it.
Monkey.
I
Unrelieved.
give you guys that 100 times. When a patient is having pain, and the pain, I put on pain medication, what
When the patient has
do you call giving
That's
pain,
virtue.
pain management? It's not working.
when the medication, when the pain management
You
doesn't
give in the pain medication, the pain is still, patient still crying out for pain. Management is not working. What is it that you call it?
Is that breakthrough?
Breakthrough pain. Come on, guys.
Breakthrough.
Patient is having breakthrough pain.
Not even sure.
And when the patient is having breakthrough pain, now this when you got to refer back to your what? To your care plan.
Care
It's
plan.
not working.
You gotta redo it again.
Reassess.
Reassess the patient.
Let me take you guys to this. Let me just take this again, Guys, stay focused, please.
Complaining, I call you so many times. Not pick it up.
Yeah, it's my fault.
You know, somebody called me, and I got that's the very first disappointing call. All the other calls I've been receiving was, you passed my exam, I passed my exam. This one person called me and said, she did her exam. She failed.
Oh, I'm sorry. Fell.
And one of the things I noted about it, I can say who will pass, and I can see who will fail. And when I look at her and what she used to do to me, I know it will be a challenge. Some people are serious about what they do, and some people want receipts. And when I say want receipts, you know exactly what I mean. You have a seat. Some people have, and I'm sorry, I'm straight talking. I'm not bringing nobody down. I'm not calling no names. I'm just saying what I see, what I've observed, and listen to the questions and when people are talking and answers. And then where my conclusion will come to. I always say it, and I'm going to say it again, every one of you can pass. But if you don't put the effort in to make it successful, it's going to be very challenging for you. And I was very disappointed when I heard this young lady say she failed. And you know why I felt so much disappointed? Because when I was at the graduation, her husband came up to me and he said, I've heard so much of good things about you. So her family even started to believe in what I'm supposed to be doing. So when she said she failed, I feel it. Because she talked with her family about what she's doing in the classroom. And she's doing things that I asked her to do, which is what? To share information with her family. And he was, when he came, I'm telling you, he came looking at me. He's shaking my hands, nah, you the best, my wife is this, and he's talking on and on and on. And I was like, whoa, okay. She did what is asking for. But she's a very Christian lady. And she's involved in a lot of Christian activities, including preaching. And in fact, she gave me some CDs in her hand. Very, very religious-minded person. So, I know that she tried and she failed, and that made me very disappointed. I don't like getting disappointing news. I hate disappointing news.
She'll pass.
I don't, guys, don't even put it in your head, but you're going to do it again. Once, and that's it. That's what you put. When you write in the care plan, all your goals is the patient will. W-I-L-L. Every goal in the care plan is the patient will. This will happen. There's no maybe. It's will. As mean is what? You put in a positive PMA. Alright, let's do this PMA, positive mental attitude. But I want you to look at it as being half full and not half empty. Look at that glass as half full, which is a positive approach, and not half empty, which is a pessimistic approach. Nobody could keep you back with yourselves. Nobody. Your husband, your kids, nobody could keep you back but your own self. There may be challenges in your way, and challenges are there for you to overcome. But one of the problems we have in this industry and in other places is that people rationalize their failures. They find an excuse of why they fail. Oh, I failed because I didn't used to go to, I couldn't attend classes because, I had to work so hard. I had to do 2-3 different jobs. That's why. That is rationalizing, guys. Don't do that. You choose it. You choose to do this. And you know one thing they always say? A bad workman always blames his...
A bad what?
A bad workman always blames his tools. You're going to blame everything else except yourself. I'm telling you now. If you mess up, you're going to blame everybody and everything else except yourself. Oh, I didn't do this. Oh, we should have done that. Oh, this is... So now you got a long time to prepare. You got lots of time at home. You'll be at home. But if you're just going to sit back, and you know what? Some of you are going away for the graduation. It's a very nice event. Beautiful event. But the graduation will become a piece of paper that you can't use. A very expensive piece of paper. Because you paid a lot of money for it. And you have it there and you say, oh, I'm a graduate of whatever. But can you use it? You become a graduate nurse and working with facilities. Right now they're looking for a whole lot of nurses. And some facilities are going to take you on as a graduate nurse, right? But guess what? You have to pass exams. And if you're going up there and you fail the exams, what do you think is going to happen? Guys, please, do me a favor. I don't want to hear any more of these negative. I was hearing good calls all the time. I felt wonderful. And then this person who I know is a very religious person called me and said what she said. I know that I had a nice conversation with her husband who was taking so much. It hurt me. It hurt me. That's why I'm a little maybe hide today. Because it hurt. I don't want to get started. I really don't want to start. I want to put your best foot forward and sit down and try to understand these things. For those who are working in facilities, in fact, yesterday I listened to, not yesterday, sorry, Sunday, I listened to a conversation in which a person was saying that she's having such a hard time because people in her job heard that she is doing the RN course. So she's having a difficult time. What I want you to do, even if some people know that you're doing an RN course, and better yet, if they don't know, is that I want you to utilize the opportunities that you have in reviewing records. Choose those opportunities. Go up to the nurse. Talk with the nurse. So nurse, what is patient got? Talk with the doctor. Doc, yeah, this patient got what have you. So what will you take? Get into that interpersonal relationship. If you're working in home care, a lot is depending on you following whatever's been put in place by that home care nurse, that registered nurse, who do the UAS. But you have to ask why. I tell you guys why. And everything you do, you have to do it based on your nursing process. That is why one of the first things you got to do is nursing process. That comes in your foundations of nursing, fundamentals. And you guys know what your fundamental of nursing is, right? Guys?
Yeah.
Somebody read fundamental of nursing to me very loudly. Somebody read fundamental of nursing for me very loudly. Anybody, fundamentals of nursing.
Fundamentals of nursing are the forces that teach the basic principles and procedures of fundamentals of nursing are student actions, classes, and provides help children, patients.
That's well, let me hear the rest. I want you guys to listen to what it is all about.
The course highlights the significance of the fundamental needs of humans and competence in fundamental skills as prerequisites to providing extensive nursing care. The nursing practice has to be dependent.
Roach, stop please. Please don't do this. Alright? Because fundamental of nursing is something that you have to know.
It's teaching the aspect of
The nursing practice has to be dependent and based on nursing theories. These theories are proven and tested for many years. These theories are the basis of the nursing discipline and what makes it a profession. The nursing concepts supply direction and assistance for structuring professional nursing practice, advancement, and research. It also differentiates the focus of nursing from other professions. It is designed to guide assessment, involvement, and evaluation of nursing care. It goes on and on.
Fundamentals of nursing is the very first course that you will do as a nurse. With fundamentals of nursing, they will want you to understand what is your role as a nurse. Fundamentals of nursing is based on the nursing process, on the concepts. Who you are as a nurse, who you are that you now will be saying, I am calling a diagnosis. I am not waiting on a doctor for a diagnosis because I am a licensed, trained professional. I make independent decisions. And you go through the entire fundamentals of nursing, and you're going to hear that all the time. And for this year's Nursing Week, it dealt with what? Leadership. Leading, you're leading. And I keep saying to the guy, I'm proud to be a nurse. And it's one of the youngest, if not the youngest profession. We are developing. We're getting better. Gone are the days when we walk behind the doctor. That don't happen anymore. That don't happen anymore. They treat us as professionals. Guys, I want you to utilize this opportunity. Go through your fundamentals of nursing. Utilize the opportunity to do interaction with your co-workers, whether it be CNAs or it be the medical director. Do not be afraid to talk to people. Don't be afraid to talk to people. Interpersonal relationship is very important. A lot of persons are scared to talk to people because they think that that person has more knowledge than them. And are overwhelmed by knowledge. You're not overwhelmed by no knowledge. You're looking for knowledge. You're looking for the knowledge that they got in their heads. So don't back off. Ask questions. But the most important thing when people tell you things,
Verify.
you verify. When I teach you, I tell you to do what? Verify it. Don't take anything people tell you just like that. Things keep changing all the time. We're coming to the end, guys. And right now, my biggest concern is understanding. How you understand what you've done. I know some of the persons in here, I can see the effort. I can see the effort being put out by certain persons. I review, and by the way, I have to give you guys, as I said, I will review with each one of you, your records. When persons are making problems, I will call you and I'll tell you. When you don't come into the classes, I will tell you. Yesterday, Ms. Basura, the first day she was missing from classes.
Amen.
And I was like, why is she missing from classes? Because they said of her what? It's strong. I have no problem with that. But like I told people what I tell you guys yesterday, I live right down what?
Across the street.
And unless I say in those classes, there's going to be classes. But if you have you're scared for your safety, I understand that. But don't come and say maybe there ain't got classes. Because there will be classes. I will be here. I have never missed one day. I have never missed one day. I ensure that I put things in place because I know I have to teach. I love to travel, but because of these classes, I cannot travel the way I travel. I like to travel to the country at least every 3 months. I like to jump in a plane and fly out every 3 months. I jump in a plane and fly and go down to Jamaica and hang out for the weekend.
Nice.
Or I go down to my country and do things that I have to do. But because of the classes, I can't. I have to be here. And I cannot say, oh, well, don't worry, I'm doing it. No. Same thing goes with the college. When they give me the schedule, I have to do what I gotta do. I have to set up my personal time to ensure that I maintain. So if you don't set up your personal time and follow, what can I say? I do not take people's numbers. One of the things I give everybody, you might have my number, call me and ask me. Everybody got my number.
I don't
I
have
don't
it. I don't have it. I don't have it.
I put the number up there and I say, I don't want your number because I don't call people. Call me and let me know if something is happening.
So put it again. Put it again.
Because yesterday, anyway,
We have to
whatever.
call you when we test the ink
Take
so you
right.
gotta put your number on.
Like I said, I gave her my number out and I don't know why. I wrote it on the board.
Right?
Run it again. Run it again. One more time. I wasn't here that day.
Also, guys, let me clear before we move on. Some of you, and when I talk to you individually, I'm going to go over this. You need to still be more focused. And this is based on your responses in classroom and what I have in your file. I have done what I've asked, that mental standard, that students should have the ability to go to any class. Once I'm teaching, you can go to classes. I had a couple of days, some people came to the Monday, Tuesday, Wednesday, Thursday. Some people from other classes came on the Sundays. But I'm telling you, it's optional. It's giving you an opportunity to make up. It's giving you an opportunity to make up. But, like my Saturday class is very large. There's 30-something in here, you packed.
Wow.
Very packed. But I still will find a way to accommodate persons. But only thing I say with my Saturday class is, nobody come in what you guys are interested in except at home in that maybe uniform, or else you'll come into the classroom. And when you come into the classroom, you're going to find that there are study groups. And study groups are there, and it's been working fantastic. That right now, they're where you are at now, and they're only halfway through. Because you're able to put things in place, you can make it happen. We learn as we go along. I am saying that if you have the opportunity, you come, but don't come in late. It starts at 10. And it's going to be 10 to 5, and usually it's like 4 or 4:30, because the people coming all the way from Philadelphia to We're coming from all the way upstate New York. And it's a lot of you. I mean, in fact, it's a lot, really, really a lot. But I'm really, really open for you because I know some of you need it. I'm not going to read no thing about it, some of you need it. And I'm going to suggest, maybe don't even come to this, but get the classes somewhere else to follow up on. Do review classes. Pay for review classes and follow up with somebody. And don't wait until you get to reply back from whatever state you're doing it with to say you're going to write the exam. Because you'll be disappointed. You got to keep at it, and keep at it, and keep at it. And when the state send you back that information, for you, a date for you to write your exams, like the week before, you're going to do a 3-day review. Now, I always got a lot of review classes. Do a 3-day intensive review. So when you go sit down in that classes, you ain't gonna fail. You're ready. It's like those boxes, you know, there's boxes and boxes all the time on the train, and then you have to what? Peak for the day of the fight. So you're gonna peak for the day of your exams. But right now, guys, you have a lot to work with. I'm not going to be kidding with nobody here. You guys have a lot to work. And I'm not saying this to say that you have not done a lot. You have done a lot. But like I said before, understanding what you've done. Understanding. Okay. Wow. All right.
4:30.
You're saying that the muscular system, you can get all of these problems, and Mr. Ikea was saying something or otherwise about belladonna?
Belladonna and
No, right?
yes.
What's buscopan? A lot of you, some of you give buscopan. See buscopan. B-U-S-C-O-P-A-N. What's buscopan?
BUSCOPN.
C-O. P-N. P-A-N.
BUSCOPAN.
What is buscopan painful stomach cramp?
Treat cramp or abdominal pain. It's a medication used to treat crampy abdominal pain, esophageal spasm, renal colic, and bladder spasm.
Spasms, right?
Yeah.
Abdominal pain. Women, when you get your periods, you use ibuprofen, and those sort. But it depends upon what?
The pain.
The intensity. The intensity of the pain. Some people get mild pain. Some people, they don't even know when they get in their period. Have you ever gone down the street and see a woman that blood run down her legs? Oh, I've been at a carnival and a woman wear white pants. Lord have mercy. And where she was, I know for her to get to transportation or what have you, is a far way. And this whole thing of people like laughing, because that's West Indian. Carnival, and she was... Some people know. Some people don't know. So if you don't know, what should you keep in mind? Come on, this is your nursing management. If you don't know, because you don't get that pain, what should you do? Or what would you advise somebody? Do what? You track it.
Yeah, you track
You
it.
keep track of it. So to keep track of it, you must know your menstrual cycle.
When you have it.
Basically, you're talking about your ovulation.
What does have to do with that?
Does that have to do with this? When you don't know you're having a period, it is dangerous to have one. Why?
To get pregnant.
What's the reason?
No, I'm asking. Why is it dangerous to have sex during their periods? People have sex during periods, right?
Yeah.
People do.
Yes, they do.
Yes, they do.
How many times people have been gone to bed and they're mashing up the business, and then next morning they wake up and see blood all over the place?
Yeah. Yeah, that
Because
happens.
you didn't know.
Yeah.
Right?
Because they didn't know if they're gonna
And
have it.
everything feels so nice and slippery. But then
Yeah.
their brother was sleeping pump. That's normal.
That's normal. It happens.
But this is where transcultural nursing will come in now, because the Muslims will say that's what? The dirtiest time of the month. They don't want nothing to do with you. That's a whole thing. That's the Muslims. Right? But Christians, if it happened, it happened. God get a piece, you gotta get it. And some women, and remember, your ovulation cycle is on your estrogen and your progesterone. And there are times when women are having their menses, they are high. They want to have more sex more than anybody else. I'm telling you what it is. Some women get sexually high during the time that they're having their menses.
That's true.
I don't know, man.
You're not lying, Mr. West.
Why do you look at you? I'm not looking at you anyway.
You're not
Alright?
lying.
So, teaching plays a very important part. So the pain, unlike men's pain, they said that women learn from their mothers. When they see the mother getting the pain and complain every month, they say when the young girl starts getting her menses, she thinks this is what's supposed to happen. So become like a psychosomatic. Now look up the word psychosomatic.
Psychosomatic.
Psychosomatic. No. Psycho. P-S-Y.
Caused or aggravated by a mental factor such as internal conflict or stress.
Stop this before. Guys, Akia is reading it. So let's listen to Akia. I know you might be looking for it, and that's no problem. But listen to him so that you can fully understand what it's all about. Start over, please.
Psychosomatic. Of a physical illness or other condition. It is caused or aggravated by a mental factor such as internal conflict or stress.
Internally comes out externally. I remember pain is what? Feeling.
Internal.
It's subjective. But some people, it's take on things. And I'm not talking about a person who may have an amputation of a limb and getting what you call what? A ghost foot or a ghost limb, right? I'm not talking about that. I'm talking about some people will actually think that they are pregnant when they're not. And their menses will stop. And they even have the belly swelling up. But they're not pregnant. Remember what we did when we talked about psychiatry? Belief. Belief can kill, belief can cure. If you believe, then your body will start, because you didn't
Manifest.
unconsciously. You're causing stuff to happen.
What happened to your body?
You're causing stuff to happen. Remember, anxiety causes people to get skin problems. Anxiety causes you to break out with stuff on your skin. And you'll be like, how the hell is that? How do you get break out with your skin? Because of something that's going on in your head.
I'm gonna believe every day I'm not.
Psychosomatic. Very important to understand that. A lot of people who have internal conflict. People have problems going on. internalizing it. The mind is a very powerful thing. Very powerful. And like we said yesterday, when a person is having problems with the mind, and they start to have behavioral issues, that is when we start to put them on psychotropic or psychoactive medications. Before that, they get the what? The psychologist to talk to them. That's when the psychologist is going to talk to them. When they say, oh, this is happening, I feel this. They'll try to find what caused it. What triggered it? What is the root cause of the problem? Root cause analysis. Please look that up, please. You guys supposed to do root cause analysis.
Root cause analysis.
Analysis.
Root cause analysis is a systematic process of identifying root causes of problem or events.
All right, stop. It's a systematic or systemic approach to identify the sources of problems. When you have weeds in your yard, you cut the weeds down, right? With a lawnmower, what have you? But they do what? Grow back. But if you put what? Spray to that thing that goes down into the roots. When the roots are dead, the plant will die. You know the part of the sower? When the sower went out to eat, sowed. Some fell on what? Rocky ground. Some fell on good ground. The ones in rocky ground, what? Jump up. But because they did not have what? Depth, they quickly what? Shrivel up. You have to do root cause analysis, every one of you. In fact, right now with your exams, you have to know what's root cause analysis. And I know some of you will pass these exams and then you're going to go on to do what? Your BSN. And when you do your BSN, you'll be on these same laptops. And then you have to do root cause analysis with your professor. You see? So you gotta know how to work it out. Nursing theory. And you're going to have several theories by different nurses. Put on nursing theory, please.
Nursing theory.
You guys come across the nursing theory? Give you an example of a nursing theory. Look for an example of a nursing theory.
Nursing theory is forming. They took hormones according to the history of medicine, of persons, environment, health, and nursing. These four frameworks inform grand nursing theories. They arrange nursing theories and practice 11 nursing theories.
You have to have the, example, nursing with the 5 of them, rentary, non-rentaries, and then the practical rentaries. Abstract and specific. That's the reason. Exact is a pyramid, but instead of the pyramid come this way as the Maslow pyramid, it's the other side.
It's upside down.
Upside down.
Now, what are some examples of nursing theory? Now, I'm going to give you some examples. Environmental theory. Casey's model of nursing. Patient-centered approach to nursing. Theory of comfort. And where do you think theory of comfort is going to help to impact you a lot? When you start talk about what type of care? Right. Specifically, what type of care do you think theory of nursing can help you a lot with? Hospice care. And when a person hospice care is with 8 months, 6 months to live, right?
Yeah.
And what's the other care?
Comfort.
What's the other care?
Post-op care.
Palliative care?
Palliative care.
I heard you say it. That's what I
Is
said.
palliative care the same thing as hospice care?
No.
Come on, guys, is palliative care the same as hospice care?
Like
No,
comfort care?
Come, we did this talk about this before, so you should be able to jump it up.
Like the comfort.
they're not the same
Is
thing.
palliative care and hospice care the same thing?
They're similar, but they're not the same thing.
They're not even similar.
They're not similar.
Palliative care is given to persons who require more care, more comfort care.
Yeah, comfort care, that's what I said.
But they don't necessarily have an end of life that goes with hospice. Hospice have 6 months to live.
Sometimes they don't leave for.
Sometimes they live longer than
Longer
people taking care of them.
Yep.
But when you're put in hospice care, for you guys, it means that the payment is what is a factor that determines everything. Who will be paying for this care? Palliative care in a facility, then get no extra payment. It's just a patient will be put on palliative care because that patient have more needs. That's all. Nothing else. Palliative care, comfort care. But nursing theory, and when you go to do your BSN, you have to get a couple of, not these theories here. I can safely tell you, not these theories. You have to do theories. You have to. I think you got like 2 theories, you have to research for presentation online to your group, also when you send it in as an assignment. So look up theories. Theories, nursing theories is a part of who you are right now. Fundamentals of nursing, nursing theories.
What did you say, sir?
Fundamental of nursing is a requirement. Self-care, deficit, culture care theory, and all these different theories.
Human care, self-care,
Right.
nursing needs care, cure, core, nursing process theories, transculture theories.
It's going to be 11. Okay, no, guys.
These are the flashcards.
Hey.
I'm tired.
Yeah, but don't do that.
Oh, sorry.
is the 17.
Let's do a simple discussion with something. Patient has joint pain. What could cause joint pain? Let me hear you guys stop. What causes joint pain? A fall. Arthritis. Okay? Patient could fall. Patient could get hit in the leg, right?
Yep.
What else can cause joint pain?
Rheumatoid arthritis. Rheumatoid arthritis. Rheumatoid arthritis.
All right, so you have arthritis. What is a joint made up of? Tell me about a normal joint. What are the different types of joints you have? First, what are the different types of joints you have?
Ball and socket.
You have the ball and socket, and you have the hinge joint. Where would you find the ball and socket joints?
In the knee.
How do you have ball and socket in your knee?
No, your hip.
Your hip.
By when you move.
Your hip. Your hip. Your hip, your elbow.
Why you get ball and socket? No, for those people who say knee. I'm not pointing there, but there are a few persons who said knee just now. So you have these joints. Knee joint, ball and socket joint. What are these joints made up of?
Cartilage.
Cartilage. What else?
Soft tissue.
Ligaments. What else? What's the fluid in here known as? So we have a synovial fluid. Right? And this is, well, what does a synovial fluid do for you?
Helps supply lubrication. Friction.
What is synovial fluid? What does synovial fluid do?
From the bones, rub it.
Together.
You know, athletes will say that they suffer from something called wear and tear injuries. And when you have the loss of this synovial fluid, it means now that cushion is gone. That's why a lot of athletes, some do that what they've been doing in the younger days, and when they get older, they find they have a lot of problems with their joints, especially their knee joints. You have arthritis, you have two types, osteoarthritis and rheumatoid arthritis. And what's the difference? What is the difference between the two?
What do you mean?
What's rheumatoid arthritis? What, all right. What I should be hearing this person saying, right? You have an autoimmune response. Meaning that the body is attacking itself as opposed to the osteoarthritis. Wait. Guys, just look and see the definition of rheumatoid arthritis.
Rheumatoid arthritis.
Come on, guys, what's rheumatoid arthritis?
Rheumatoid arthritis is a long-term autoimmune disorder that primarily affects joints. It typically results in warm, swollen, and painful joints. Pain and stiffness often worsen following rest. Most commonly, the wrists and the hands are involved with the same joints, typically involved on both sides of the body. The disease may also affect other parts of the body, including skin, eyes, lungs, heart, nerves, and blood. They need to take it away.
Use it.
What? As I told you, with the rheumatoid is immune. Autoimmune, that is the word autoimmune. You hear it not just for the rheumatoid arthritis. You hear it for all the problems within the body. And anytime you hear autoimmune, it means that what? The body is
Attacking itself.
So wherever you see it, it's the body attacking itself. Alright? Now look at osteo. So you can know the difference. Look at osteo.
Osteoarthritis.
Osteoarthritis.
Osteoarthritis is the inflammation or loss of cartilage in the joints, usually caused due to wear and tear. Symptoms include pain.
Right, remember just now I said that athletes get a wear and tear? Complaining of the wear and tear disease. That's the osteoarthritis. From the utilizing all the time, running, jumping, moving, what have you. When they get to the older ages, that's what happens. You're going to find a lot of those guys that might be footballers in their younger days. Or basketball players or what have you. And then all of a sudden, as they get older, you find that they're having problems with their knees. They're walking. And that is why in rehab, for all those who work in the nursing homes, you find that rehab, there's a lot of money in
PT, physical therapy.
Physical therapy.
total
Care.
knee replacement. You hear that all the time, right? They want people coming for total for their knee replacement. The hospitals, when you go there, oh, you need to replace the knee because it's messed up. And when they do that, they have to go for what? Rehab. And when you go for rehab, so the facilities love them TKRs to come in. And in long-term care, it's all about money. Rehab is what brings money into the facilities. So now with the pain that's related to the bone and the joint, different type of pains. So what you as a nurse got to do now?
Pain management.
So what you're going to do that is non-pharmaceutical. What's a non-pharmaceutical?
Physical therapy. Exercise to the level of tolerance.
Exercise to the level of tolerance. That's patient teaching.
That would be, I guess so, presentation.
Okay.
Okay.
What else are you going to do for the patients who are complaining of arthritic pain? That's non-convalescent.
Home remedies.
What home
You
remedies?
said cold? Can we use like cold compress? For the flame joints?
Well,
It's gonna be warm, not cold.
Warm compress?
and heat help.
Yeah, warm.
People go in and tell to go lie inside
So they could put a warm
A sauna.
in their leg. Like a
A
warm.
warm bath?
blankets. Some people do paraffin. You know, you can use candles, right? Wax.
Wait, on your. Oh, that hurt.
Wax?
You can paraffin is. Look for wax therapy, please.
Oh, we put the
Wax.
candle.
Wax. Wax.
Wax therapy.
Wax therapy.
Wax. People, you want to put.
Never heard of that.
Never heard of it. Like they'll burn the candle. Put on here.
Wax therapy.
So I just.
I got Brazilian waxing.
Just read it in here. Just read it in here.
You can use paraffin wax, maybe called either paraffin or wax, to apply moist heat to your hand or feet to ease the pain and stiffness of the
Of osteoarthritis. You guys never heard about that? Paraffin